Welcome to the Kung Fu Mama Show. Okay, so today we have Dr. Daniel Sugai back here on the show, and he is a Harvard-trained, board-certified dermatologist specializing in medical, aesthetic, and surgical dermatology. He is also a YouTuber and a TikToker, and you've got to watch his social media videos. They are amazing. They are funny. They're very informative. And I'm going to say this just in the front because you've got to check it out because I love his videos. His IG is Daniel Sugai, MD, and his TikTok is Dr. SPF, and his YouTube channel is Dr. Daniel Sugai. So welcome, Daniel. Thank you so much for being here.
Thank you, Sarah. Appreciate it. Glad to be back.
Yeah, so last time we asked about children's skin, and as you know, I am a 35 weeks pregnant mommy, and I have billions of questions to ask you.
All right. You have my attention. Yeah, you have me all to yourself.
Great. I love this. I have like a dermatologist appointment right here.
Yeah, right.
So I think the number one question pregnant moms want to know is, what do you do about these stretch marks? Is there ways to prevent them? What do you do after them? And I've also heard that you can also get stretch marks on your breast from lactating. So tell us, how do we treat this? What do we do?
Yeah, no, so the technical term for stretch marks is stria. You can have white stria or red stria. Mm-hmm. So the white and red stretch marks are both, very bothersome for patients. But I like to say, let's normalize stretch marks. Totally fine. Stretch marks are a beautiful thing. Moms make the biggest sacrifice, like I've spoken about before. Since we went through having kids, I have tons of respect for my mom, even more so, more than ever. So, stretch marks are very tough. And I think there's a huge genetic component, unfortunately. So sorry about that. Having stretch marks is probably part of your genetics. So I know a few people who have gone through pregnancy, actually my wife included, she did not pick up any stretch marks. It didn't do anything, actually, just moisturizer. So, there's a lot of fancy creams out there with different peptides and strengthening creams, collagen creams, but they actually don't have any evidence behind them. So I always say just your favorite moisturizer that you're willing to do after a bath or a shower to lock in that moisture. And, there's studies behind Centella asiatica, which is a very popular Korean beauty ingredient that's, have you heard about it? It's tiger grass. It's in a lot of these K-beauty products, and they say this ingredient can help with wound healing. They call it tiger grass because when tigers would fight, the tiger is wounded would roll in this grass and help with his wounds. Huh. So this grass, this extract, they take it and they put it in the skincare, but they're also saying that with wound healing, also it could help with stretch marks. So I want to see more evidence behind that. I also want to see safety data behind that. Is it truly safe to use during pregnancy, those products? I'm not sure. So that we don't have any good treatments. When you see a dermatologist ask about this, it's usually just, hey, moisturizer. If you do have it later on down the road, if there's red stria, you could consider a red pulse dye laser to help with the red spots, and that can help lighten them. If it's white, and we call atrophic, meaning it's those little tunnels, those tracks that are depressed in the skin, those are very hard. You could consider doing out-of-pocket cosmetic lasers with resurfacing technology to help rebuild the collagen, but it's hard and it takes a lot of treatments to maybe get to where you want to be, and you may never achieve normal skin. So that's a tough one.
So guys, normalize stretch marks. Mamas make lots of sacrifice. Who cares about the stretch marks?
Pretty much, yeah. I'm sorry to say, but just stay moisturized. That's always the best practice. And then also not getting slow and steady weight gain too, for if you're pregnant or non-pregnant. That's also kind of hopefully minimize the chance of developing larger stretch marks.
I see. Okay, so also watch your weight gain and weight loss, I suppose, after the baby.
Yeah, that's true. Right.
Okay, well, that's the big one. All right. So, a lot of people say you can't use ABC during pregnancy, and when you're lactating, there's a lot of things. What are the things to avoid?
Yeah, so first off, I love retinoid creams, which is a vitamin A derived cream, but you cannot use it during pregnancy because if you take it as a pill, the other name is isotretinoin or Accutane, that can cause birth defects in baby. So as a cream, could it go into your bloodstream and go systemically and affect baby? Theoretically, maybe. So I always tell my pregnant patients, don't bother, don't use it. If you're even trying to conceive, just hold off on doing it. You don't want to risk it. Pregnancy is a very fragile state, and you don't want to, I always say less is more. So hold off on the retinoid creams. Hold off on the lightening creams like hydroquinone. That's a bleaching agent that you may want to consider with your dermatologist for lightening melasma that can happen during pregnancy. It's the brown hyperpigmentation you can get during pregnancy with hormonal changes, but you don't want to use that during pregnancy. That also is not safe. There's also a natural form called arbutin that you might see in lightening creams. I usually say don't use that either. Even this is the natural form of hydroquinone. So those things I'd say big no-nos. If you want to be really safe, I know in the previous chat we talked about chemical versus physical ingredients in sunscreen. I usually say just to be safe, do the mineral ingredients, zinc oxide or titanium dioxide for your sunscreens. I would try your best to avoid chemical sunscreens, at least the American UV filters. I know Asia has a lot of great sophisticated chemical ingredients. I can't comment on those because I'm not exposed to them. But for our UV filters, I usually say avoid them during pregnancy.
Okay, got it. All right. And then, of course, the number 2 question for moms is going to ask, how are you going to treat the scar after the baby, the C-section scar?
C-section scars, yeah. So C-section scars are also tricky because, for us Asians, we make keloids. I don't know if you're familiar with keloids. I guess you beating people up all the time. You might, something about scars, Sarah. But
I do have a couple of those.
Yeah,
but I always say you should see the other guy.
Yeah, right. Yeah. So caring for scars, very tough. For a wound or a fresh surgical wound, you want to keep that also moisturized. Actually, new skin comes in better when the wound is moisturized. That's actually true in the lab setting. So dermatologists don't like drying things out. They like to keep things moist after a surgery. So putting a layer of Vaseline or Aquaphor, I keep talking about this magical product, is very versatile. Putting that on a wound and then watching it. You could gently massage it. It starts to get nodular or firm. If it starts to keloid, it gets really raised and starts spreading sideways like a crab claw, that happens. And you have to see your doctor soon because we can treat those with injections of steroids, Kenalog, to help soften them, stop the proliferation of the fibrous tissue. And we can even employ liquid nitrogen to spray over the scar to really help soften and flatten it out. But big things are for any scar to be sunscreen during the day. C-section scars usually aren't exposed to the sun, but sun and scars in general, they're not friends. It will make the scar worse. And then moisturizer is big. If you get an infection after of the wound, that can just make things really hard to. You just have to really spend extra time waiting for it to fade and just keep moisturizing the area. For Asian skin, we make dark scars. When I had a knee surgery, it left a dark scar on me, and I just needed time to let it fade. And that's the same for everyone. For a C-section scar, you just gotta let it fade and just keep the moisturizer going to help with cell turnover and keeping a healthy environment for healing.
So you don't recommend any special scar cream products?
Yeah, there's no real data behind a lot of those. There's silicone dressings. It wouldn't hurt to do a silicone dressing to help keep it flat. You can you can fashion one and have it trimmed out and have it along the C-section scar fine, but there's no evidence behind that, or the evidence is not strong behind silicone dressings after for a scar, a post-surgical scar. And then there's scar creams that not convincing. So you might find dermatologists not ever talking about scar creams. Maybe vitamin E oil you might hear a plastic surgeon talking about every once in a while, but really it's just like the plain old moisturizer is what because a lot of it is genetic based. Some people just don't heal well. We heal with hyperpigmentation, and people with lighter skin tones might heal with a white scar instead. So definitely depends on your background genetics.
I see. Okay, that's good to know. I have another question, and this is just for me personally, and also those who aren't pregnant, and just anyone who has a skincare routine. I'm almost guessing what your answer will be, but what are your thoughts on the Korean 10-step skincare routine? They got the foaming cleanser, the exfoliant, the toner, the essence, the serum, the mask, the eye cream, the moisturizer, the thick cream. Oh, it's such a handful. What do you think about it? Tell me.
Korean skincare, they are very sophisticated. They got it down. I work with Korean skincare companies a lot, and I'm actually impressed by their products. But, is it feasible? Is it realistic for a parent? No. Like, how can you fit that into your routine? Really, it's been, when I remember when my kids were so young, I was just to rinse my face off in the morning was a challenge. You're so tired, right? And the kids are screaming, and you have a million things to do. You have spit up all over yourself, and you're just trying to keep the spit up from falling on the floor. It's just like, well, how can I even deal with my face? So, I think that it's fine to do. I think if you can treat yourself and you have the time, go for it. If you have the money, go for it. But is it really, truly necessary? No, I think you'll find great benefits just from doing a moisturizer or a cleanser, a moisturizer, sunscreen. You can add in a vitamin C if you want to get fancy. And then at night, a cleanser, a retinoid, a moisturizer. If you're not pregnant or breastfeeding, you can do a retinoid. But just the basics like that is really all you need. But if you want to fine tune it, if you're a black belt in karate, say, and you want to like fine tune things, then you can add in all of those other steps. Like essences are nice. I've tried lots of essences, and some of them are just you make your skin feel great and hydrated. Or
what is that? Sorry, could you repeat that?
Essence, like essence. If you do some essence,
essence.
Yeah,
okay.
So essence, yeah. That was the first time I ever was introduced to essence products, was through the Korean lines. And so, they make some really nice ones, but I don't think it's like a fundamental part, just like the face masks, the sheet masks, they're great, but they're a treat, I'll do that maybe like after this on a Friday night, I might do it, while watching Netflix or something. But I don't think it's definitely, you shouldn't have that as part of your routine.
Okay. And your thoughts on toners?
Toners, toners are fine. The cleansers are good enough. You don't really need toners nowadays because the cleansers do a good enough job in removing dirt, oil, sebum, and such. So the toners, I'd say go with the toners that are better, that actually have like more hydrating ingredients, like hyaluronic acid, or if it has like, if you want to do more exfoliating, some of them have like exfoliating properties in the toners. Or antioxidants, then you can say that's adding additional benefits. But in general, toners not necessary, and a lot of times I wouldn't use my money on that.
Well, your skin is pristine. I'm just saying,
no,
like you look like you were just born.
You're the best. Thank you. Well, you look great too. You're 35 weeks pregnant. You look great. You got the pregnancy glow, huh?
Thanks. But I think I need to use more sunscreen.
For sure. Yeah, for me, I think all of us can. I've only recently, to be honest, really to start using it like consistently during the wintertime and driving into work. And I'm indoors. And this is like one of the changes I've done recently is wearing sunscreen, even though I'm indoors, which seems silly, but I think it's making a difference.
Well, I mean, your skin really looks so nice. It's like so smooth and it looks so like supple.
Yeah, that's what we all hope for. I want those elastic fibers to stay there. I don't want it to go away. But thank you.
I think anyone would want to have you as their dermatologist.
Oh, you're too nice. Oh, keep it going. Keep it going. Okay. Oh, thank you. That's huge coming from you too. Thank you.
Yeah. Okay. So I have one more question about moms, because moms obviously have a big problem with hair loss. And I noticed that you did some videos about hair loss recently, so I thought I'd throw that one in there to our dermatologist.
Yeah.
Yeah. So what can we do to prevent or to help with hair loss or help with hair growth? I mean, like,
oh my gosh.
I know I used to have more hair.
I know. Yeah, you're hitting me with these hard ones, Sarah, because a lot of these actually, there's not a lot of good, treatments for these things. And I'm sorry for the audience. I mean, it's just, the thing is the hardest things to treat would be toenail fungus, hair loss, stretch marks are probably like almost impossible or very hard to treat. That's why you have a lot of rich people, these celebrities who go bald and, they talk about hair transplant surgeries and such, but nothing's perfect. There's no magic bullet to fight these things. So when you are pregnant, you can, you go through all these hormonal changes, and when you're done, you have this hormonal drop, and you can lose your hair. And some people even get like other issues during pregnancy. Like I've known people who've picked up an autoimmune condition like lupus, postpartum. I've even seen people who've gotten postpartum hypothyroidism, and those things can cause hair loss too. So there's different causes for hair loss. The most common though is telogen effluvium, which happens from a big stressful event like going through labor. So when you have a stressful event, you're going to have all your hairs go into the sleep phase. There's different phases of your hair growth or your hair cycle. There's the growth phase, which you want your hair obviously to stay in as long as possible. And then there's the I'm going to go to sleep phase, and then there's the sleep phase. And if you are stressed out or sick, if you get say postpartum hemorrhage, or something big, traumatizing event during labor or in the surgery, you can definitely make your hairs go into sleep phase and fall out very quickly. So that would just be time to recover. It can delay about 4 to 6 months of recovery after that to get your hair to start growing back as little baby hairs and they thicken. Big things you want to do for hair hygiene would be to keep your hair, when you wash your hair, you're going to expect shedding, but just do a gentle, scrub with your hand, and when you get out, use a towel to wrap your hair or pat dry. You don't want to use frictional rubbing with the towel. You don't want to use a blow dryer as much as possible, because that can also cause little bubbles to form in the hair shafts and they become more brittle and break. You also don't want to do iron your hair while it's wet, because it'll do the same thing. You'll have little bubbles that form in the hair shaft with the heat, and then the shafts will break. So that's huge. Just knowing that for anyone who's not going through postpartum hair loss or not, that you're going to lose your hair about 100 hairs a day. When you're going through postpartum hair loss, you're going to lose more than 100 hairs, and you just have to just accept it and just hopefully wait on it. I wouldn't go as far as doing the Rogaine while breastfeeding or nursing. I'd wait till afterwards. If you're still having hair loss, you can consider those over-the-counter like Rogaine, minoxidil options. You can always talk to your dermatologist about other prescription medicines. If it's hormonal related, there is a medication called spironolactone you could talk to your dermatologist about for hair loss. But yeah, that's kind of it. There's no real magic bullet. If you're having really bad, like dry, itchy scalp or dandruff, see your dermatologist to get that treated if your over-the-counter anti-dandruff Head and Shoulders or Selsun Blue shampoos aren't working. You want to control that yeast, because if you're having inflammation of your scalp from the yeast, you're going to lose your hair too. And it's very common to see in women and males, that condition. So this is a harder topic than the kids. Yeah, this is hard. It's a lot of like, sorry guys, we don't have a lot of good treatments for these things. But yeah, I definitely have lots of respect for moms for sure, because there's a lot of things you can't do. Like, acne. You're going to have acne during pregnancy. Second trimester, it can be really rough for people. And then third trimester, you get the glowing skin, the glowing hair like you do. And that happens. But if you have acne, you can't use a lot of things. If you get eczema during pregnancy, there's an atopic eruption of pregnancy in your second to third trimester. You can't give a lot of things. Just topical steroids in the small surface area is what is allowed. But moms are very much limited on what you can do. You're going to get melasma during pregnancy, that mask of pregnancy, the brown hyperpigmentation. There's not a lot of things you can do during pregnancy and while nursing too. So it's hard. I'm sorry.
Okay. Well, I guess is there any other advice you'd like to tell us new moms for our skincare?
Yeah. Yeah, I think just, you're gonna be in survival mode in the beginning when your child is, when you have a newborn. But, sleep is important for your skin, for your mind. I know that's in short supply, sleep, right, in the beginning. So, it's just trying your best to get as much sleep as you can, because a lot of our collagen production happens at night while we sleep. Trying to keep a healthy diet, which that goes out the window too when you have a newborn a lot of times, right? It's the ultimate sacrifice. And, sunscreen when you're out playing with your kids. You want to set good examples for your kids, wearing sunscreen as much as you can, trying to make it fun by putting sunscreen on yourself, put it on them, make it a thing you guys do together. My kids know what the sunscreen, where it is in our house. They grab it. They're like, here's the sunscreen, Dad. They know to get it on themselves before going to school or if we go out to the park. So, you want to make sure you take care of yourself and set a good example for your kids. You don't have to show them like, oh, I'm doing vitamin C serums, I'm doing retinoids. I think sunscreen is the biggest thing, just to show the kids, just to stress that it's important. But yeah, I mean, I see mothers all the time for, skincare advice right after pregnancy. I'd say maybe wait until you're done breastfeeding if you want to talk about treating like hyperpigmentation, melasma, acne aggressively. If your acne is getting worse while nursing, definitely come and see us sooner. But if you have time, if you want to work on like treating yourself with chemical peels or working on hyperpigmentation, you might want to wait till you're done with nursing, because there's a lot of things you can't do while nursing as well.
Okay. All right. Well, we just have to continue making the ultimate sacrifice for a better world.
Yes, exactly. The future generations, we're putting all our time and energy, our livelihood, our youthful skin is put on the line because of these kids, these kiddos. But yeah, it's the hard. I say being a parent's harder than residency or medical school. Like seriously, it is the hardest job, but it is truly the most fulfilling. There's a lot of sacrifice that come through, but there is light at the end of the tunnel. Like, my kids are older, that's why I'm able to do a more sophisticated skincare routine. I know guaranteed, if you were to ask me 3 years ago, could you do all these things? I'd say, heck no. Like, there's no way I would have done vitamin C serums. I was just like trying to survive. I was so tired in the morning, right? I just washed my face, maybe just to wake myself up. But yeah, it's you as the kids get older, it's going to get easier, and you can start caring for yourself more, and then it's more fun seeing your dermatologist, and we don't have to say, oh, sorry, you got to wait till you're done with this, you got to wait till you're done breastfeeding, or you got to wait till you're done being pregnant. It's way more fun. You can start doing peels, lasers, and fillers, Botox, stuff like that. The fun stuff.
Oh, that brought me to one more thing I thought about, which was like, do you have any suggestions? It's probably another hard one because these are all things everyone asks. Like, what about like eye bags?
Yeah.
You're like, good luck.
Oh yeah, eye bags. Yeah. So yeah, eye bags are tough. I mean, there's genetics. There's for sure plays a role. Aging will make you have eye bags because we lose bone here, and so when you don't have that bony structure, you're going to start to have saggy skin, leaving a bag. So, things to help combat eye bags. If you're having saggy or loose skin, and you had a good night's sleep, so 1, get a good night's rest. 2, consider a caffeinated eye cream to help tighten that area up.
Caffeinated, like caffeine. Wow.
Yeah, caffeine in your eye creams.
Okay.
3, you can consider keeping an extra pillow under your head to keep it elevated and inclined so that you have better blood flow going away from your eyes instead of pulling right here under the eye. And of course, keeping it moisturized. So keeping an eye cream underneath your eye before going to sleep, and when you wake up, do that caffeinated eye cream to help tighten that up. Before jumping into any filler, always think twice. Like, some fillers underneath here can make your bags worse, so make sure you go to someone who knows what they're talking about and evaluating, will eye filler under here work for you, because it may make it worse.
Good to know. Okay, awesome. And on that note, we should just all get more sleep.
Yes, yeah, I know. Totally. Yes. Sleep is important. 7 hours or more if you can.
Okay. Well, thank you so much for all that information. I'm sure all of our mamas and papas out there are very thankful for what you've told us all today. I look forward to keeping in touch with you.
Yes, thanks, Sarah. Appreciate it. Thanks for having me. Thanks to all the mom and dads for tuning in.
All right, great. Thanks so much.
Okay, see you later. Take care.